In this video, we will demonstrate the thumb spinous adjustment. As a reminder, the thumb spinous technique is used to correct for an ipsilateral relationship of rotation and lateral flexion. For example, a segment that is right rotated and right laterally flexed. In this example, we are correcting T1 for right rotation and right lateral flexion. Since this is an ipsilateral relationship, we cannot correct for both rotation and lateral flexion in a biomechanically efficient manner at the same time. So you must choose which component to correct first. In this case, we will correct for lateral flexion first. The thumb spinous technique is assisted for lateral flexion and resisted for rotation. In our example, the spinous of T1 has deviated up and to the left. Therefore, we will contact the left side of the involved spinous, T1 in this case. Since our correction for lateral flexion uses an assisted technique, what joint are we affecting? Remember the ABRA concept? Assisted techniques affect the segment below. Since this is an assisted technique and we are contacting T1, this means that we are affecting the T1-T2 joint, which is a joint that we originally evaluated and found to be dysfunctional. When using the thumb spinous technique for this subluxation, stand in a low fencer stance facing headward on the left side of the patient. Contact the left side of the T1 spinous with the left thumb, dragging tissue slack from left to right. The forearm is parallel to the ground. The right thumb will contact below the right mastoid process with fingers to the face. Now, lift the head up and out of the headrest. What do you see in terms of pre-stress at this point? Is this pre-stress helping or hindering the lateral flexion component of the adjustment? Can you see that we have taken the head out of right lateral flexion and into left lateral flexion? This sets up the correct pre-stress to help our adjustment for the lateral flexion component. What has this head position done for the rotation component of the subluxation? Can you see that we have turned the head further into right rotation, which would hinder our adjustment? If we wanted to correct for rotation using the thumb spinous adjustment, we would contact the opposite side segment below. In other words, the right side of the spinous of T2. The next video clip will show the entire sequence of events ending with the thrust in a line of drive from lateral to medial across the shoulders.